Hi everyone, this video about neck treatment, about how to fix the displaced vertebrae in the neck. The first step is diagnostic. We should know where we have displaced vertebra, the reason of this, and how to fix it. The first step is a special muscle testing. For example, if we have the displaced of the fifth neck vertebra, we have the compression of the fifth cervical nerve, and we have a weakness of the deltoid muscle. And we will turn the vertebra to the one side and testing the muscle, and to the other side and also testing the muscle. And when we do it in the proper direction, we make the cervical nerve free, and so we know how we will do the manipulation of the neck. The most common reason of the weakness, the most common reason of the displace the vertebrae at the neck is the different strength of the muscle that stabilizes the neck. For example, the long neck extent is a big muscle that stabilizes the cervical spine, that stabilizes the neck. If one portion of this muscle is weak, the another portion, for example, if we have the weak long extens at the left, the right neck extens will become shorter, and it is and that's why the vertebrae became unstabilized. And when somebody who have this problem turn his neck or bend one on another side, his vertebrae become instability, and it is a reason of subluxation and fixation of his vertebrae. The first step is diagnostic, and we should know where we have the displaced vertebra and how we determine the direction of the manipulation. And the first step is we will find the displaced vertebra. For this, we put our fingers on the process transversus of the vertebra, and our patient bend his neck forward. And we see that the move of the fingers is different. And then we test the deltoid muscle. We know that we have the displaced of the fifth neck vertebra, and then we make the muscle test to deltoid muscle. Push up, and we have the strong deltoid muscle. If we have the strong compression of the nerve, we can see the weakness of this muscle in push up, and if we have the strong compression of the muscle, we can see the weakness of deltoid muscle in this position. And if the compression is not so strong, we should do this test. We bend his neck forward and testing the muscle in this position, and we have the weakness of the muscle in this position, and we have now the weakness in this. The reason of the weakness in this position in the compression of the fifth cervical nerve in this position. When he do this move, when he do this movement, his nerve compressed by displaced fourth and fifth vertebrae. And now we should to know the direction of the manipulation to this vertebra. We turn the fifth vertebra to the one side, bend his neck and push up, and one more time, turn, bend and push up, and we have the strong muscle. And if we do to another direction, bend his neck, push up, we have the increase of the weakness. And now we know that we should do the manipulation to the right side. Now we will do it. We find the fifth neck vertebra, find the joint between the fifth and fourth vertebrae, the direction that we find, and the manipulation. Sit down and testing one more time to check what we did. Push up, and now we have no the weakness of the deltoid muscle, and we check the movement of the fifth vertebra. Bend your neck, and the movement of the both joints are the same.